And joining me now is National Party leader Christopher Luxon. Hello to you.
G'day, Chris. Great to be with you.
Good to see you as well. Let's start off with the Prime Minister is expected to make an announcement on Wednesday regarding COVID mandates. What's your thoughts on that? Because I know that on Friday you said that most mandates should go.
Yeah, look, we're in a place where Omicron's, narrow risk that we're managing that's very, very different from earlier variants of Delta, and Alpha. And as a result, the risk is very different. So we're saying right now, you could actually remove vaccine, passes to get into restaurants and cafes. You could certainly remove vaccine mandates for under 18s. You should certainly be thinking about remove all vaccine scanning immediately and actually move the isolation period from 7 days down to 5. So that would be an immediate set of actions you could do today. And then come April 13th, it all changes again, Chris, because we've got all those Australians coming over the border. So we would pull down the traffic light system at that point. There's no need fundamentally for pre-departure testing. And the last thing is then we'd progressively remove those mandates and you'd really start going through them. Because again, the case and utility for mandates and passes is no longer there, or the justification is no longer there in an Omicron world and where we are today.
Well, last week I asked Dr. Ashley Bloomfield that question. I said, are vaccine passports an irrelevancy? He said, no, they still have a part to play in keeping people safe. But I was trying to understand how that's the case. Because if I go to a restaurant, I've got my vaccine passport, that's all very well. But if I've got COVID-19, I can still transmit that virus.
Yeah, exactly. That's the whole point, is that the risk is very different. And I just think the government stayed in a 2020 mindset in 2022. And it's actually really important you keep evolving actions and the measures in light of the threat that you've got. So you're exactly right. I mean, the reality is in Omicron, it goes right through the vaccines in terms of contagion. And so therefore vaccine passes and vaccine mandates aren't that good a protection or very useful to us. It certainly helps you in terms of not getting as sick. That's a good thing for us individually. But look, we just need to move on and we need to get the country back to some normalcy again. And so we know where we're going now, with respect to borders opening up. The other interesting thing I thought yesterday, Chris, was the government sort of said that they would let unvaccinated people returning to New Zealand come into the country. Well, if you've now said that's okay at the border, then why can't an unvaccinated person within the domestic, New Zealand actually be able to travel around as well? So what's the logic again between saying yes at the border if you're unvaccinated but not within the community?
The government made that announcement quite sneakily by the sounds of things on Friday night. They just put it through on the MIQ website without much of a fanfare, no major announcements. Do you think that was a bit devious? That felt like that was a quiet announcement. Even people on the left were saying that should have been much more of an announcement everywhere.
Well, look, when you've got these big platforms of 1 o'clock announcements and post-cabinet announcements, and they make a big song and dance about the press conferences, why wouldn't you do it there? But burying it late on a Friday night when no one's looking or watching, or there's no media watching or looking, and there's no announcement of it, just doesn't feel right. So, I mean, but the key thing is the logic now doesn't hold. So you've got to be saying to the government, well, you got to push on and actually remove these mandates because you're saying it's fine for unvaccinated to come in on the border, but not within the country.
Having said that, there are still people in ICU. There are still people dying with COVID-19. I wonder if your announcement was premature. When we still have cases the next day, and in fact in Christchurch and Canterbury, the most cases now in all of New Zealand.
Look, I think what we've got to face up to is we are 95% vaccinated. We are, I think, 72%, boosted as well. And the really big group that we really are concerned about is the over 60s, and they're actually 85% boosted as well. So, yeah, I mean, I know there's a life of risk, but we're trying to manage risk well and intelligently and balance off a lot of things. But the reality is, I think we're ready to go. Of course, there'll be a need to make sure that you isolate if you're a case or a household contact. We're saying that should be 5 days, not 7 days, which is the US model, following the CDC advice. We're also saying, look, there'll be times we have to have masks on indoors, and I think, there's the sort of things that, and again, if a situation changes or a new variant arrives, well, we put in place a different set of tools to help us manage that one.
And to manage that, we need doctors and nurses. Over the weekend, Erica Stanford put out a statement saying that we weren't doing enough to encourage or to get doctors and nurses from other countries here, or in fact, at least get them residency. Now, I know of many cases where that is happening. What's the problem here with Immigration New Zealand? Chris Farfoi says there are no problems. Immigration New Zealand's working as fast as it possibly can.
They've been an absolute utter shambles and a debacle now for some time. And in fact, they were going that way before COVID. Many of the visa classes in New Zealand had actually doubled the processing time before COVID. The bottom line is the government's been quite anti-immigration. Of course, that's been a major problem because every sector of this economy is really impacted. You're dead right about the healthcare workers. That case of that lovely Welsh doctor that was in Otaki, had 1,300 patients, couldn't find a pathway to residency, wanted to buy a house, wanted to start up a KiwiSaver account, get settled here, left, I think went to Canada, and now we're advertising for his job in Scotland again, all because Chris Farfoy couldn't get it organised to get the healthcare workers here. So every healthcare worker we either train, nurse here, every net one that we bring in, there's a net one that goes. And so it's a total tunnel of resource that doesn't stick. And I think when the borders go down, I think we could be at risk of losing more of that critical workforce. But to give you a feel for it, just to be at the same level of where the New South Wales was, we needed 14,000 more nurses, we needed 1,400 more doctors, I think 1,300 more hospital specialists, just to be on the same ratios of caregivers to patients. And so, it's been a big problem because we haven't got a single extra staffed ICU bed since this thing began. Yet we've spent $50 billion in a COVID fund. None of it went to an ICU bed. And certainly there's a lot more effort needed on healthcare workers, big time. The reality is the world's taking off. If you want the best in the world to come to New Zealand, it's not just because we're a lovely place. They've got a lot of other options in a world of 195 countries, 7.8 billion people. So you want the best, you've got to be the best, and you've got to have the best immigration system.
Christopher, let's turn our attention now to the economy. I was speaking to many independent economists last week, and they say they're nervous about Grant Robertson's budget of 2022 being, $6 billion. They believe that this is just going to push up inflation even more. But that depends on how he spends the money. He could spend the money very wisely. Education, health, those types of things. I mean, that won't push up inflation, though.
Yeah, well, I mean, Chris, here's the deal, right? I mean, this government's come to power. By the end of this year, they will have had a 68% increase in government spending, 68%. We've then doubled the debt to 120 billion, but this actual government spending is now at 128 billion dollars. And on top of that, he's going to give himself another $6 billion on top of the baseline that he's already been adding to over the last 4 years as a new money that comes in this year. And that's the biggest budget increase in the history of this country by a long shot. And all we're saying to him is, look, Grant Robertson's addicted to spending. He'll go off and do wasteful stuff. There is no measures and targets now on the public service. So you don't know whether you're going to, if you spend money on health or education, how do we measure the outcomes and what you get for that money? That's all gone. That's just too hard to have targets on anybody. And as a result, we're saying of that $6 billion, just take a third of it and let's give it back to the New Zealand people, because we could do inflation-adjusted taxation thresholds, which you have to do at some point. You can't just leave taxation thresholds the same for 30 years. There's been 11.5% inflation, and then everyone actually floats up. You don't capture people in tax bracket creep. You've got people who are getting like a 2.5% pay increase, which is less than the 6% increase in inflation. They move then into a 33% tax bracket at $72,000, the average income here in New Zealand. And then they're caught paying higher levels of tax on a pay increase that already doesn't cover the cost of living. So, we're just saying we trust the New Zealand people to spend that money or save that money much better than what Grant Robertson would do.
Jacinda Ardern apparently was on the radio over the weekend saying if there was one regret, maybe I'm putting words in her mouth here, but if there was something that she wished she'd done with COVID-19 is take more people along with her. Do you believe that we have created more of a divisive society as a result of either COVID-19 or the restrictions put in place as a result of the virus?
Yeah, look, I think we have. I mean, but I'd say it's a broader issue. I think this government's come to power and it said, look, farmers are villains. It said that landlords are, rampant property speculators. 72% of landlords are people who own one or two residential investment properties, and they're often teachers or principals or, who are just trying to do the right thing, augmenting their retirement income. And so there's this tendency, employees versus, employers, tenants versus landlords, farmers versus rural versus urban, vaccinated versus unvaccinated. All of that stuff is just adding to this identity politics stuff. And really, I just think we're New Zealanders first and foremost. We're bigger than those individual identities. And I think we've got to work even harder at just making sure we've got good cohesion between our different identities and different communities. And so, yeah, I mean, I think she did a good job in 2020, but I think, as I said before, 2021, 2022, we were late on the vaccination rollout, rapid antigen tests, and then now they're just responding and making it up in response to pressure from us and from you and the media and the public.
When it comes to Ukraine, you've got Kiwis that want to go over there and fight in Ukraine. What's your response to that?
Well, look, I mean, that's an individual decision. It's quite a high-risk decision because there's a whole bunch of complications there arriving and joining that fighting force where you don't necessarily, you wouldn't be able to have access to consular services from New Zealand. It'd be very difficult. Equally, be very difficult in terms of the Geneva Convention, because it's not a regulated fighting service, as I understand it as well. I just think from New Zealand's perspective, there's more that we could be doing on the humanitarian front. I think we've given $2 million of aid. Australia's given 35 million Australian dollars. We've talked about, I think we've done a good job of pushing the government again, and they've reacted. We talked about that autonomous sanctions bill. It's now got passed 2 weeks too late, but it's passed. Likewise, we're saying, look, bring in friends and family of the 1,400 Ukrainian Kiwis that are already here, at least offer them that chance of coming here. Look, there might be some Kiwis that want to go off and do that. I don't think it'll be that many, but I think we should play to our strengths and start to say, how can we help humanitarian-wise?
It's a devastating situation. I think it's only going to get worse by the sounds of things. Even looking at the news this morning, the shelling, bombings continue. National Party leader Christopher Luxon, thanks so much for your time.
Great to be with you, Chris. Have a great week.